So wanting to speak to you all this morning on the topic of promoting healthy blood sugar, and this is a very, very important topic, certainly something from a preventative medicine aspect that we want to keep in mind throughout our lives, because it is such a stepping stone to a lot of other disease processes, which we'll get into today, and hopefully give you lots of good information to take away with you. We'll be speaking for about 45 to 60 minutes this morning. So with respect, just a little overview for you, just to get you acquainted for what's coming up in the talk here. I'll do a little bit of a brief introduction and some things about me. We'll talk about blood sugar management and optimizing blood sugar. And when I say that, I really mean talking about diabetes and the diabetic complications. So that is obviously a challenge when blood sugar levels start to run too high. We get into pre-diabetic and then diabetic complications. So we'll go through some specifics of that in the talk today and give you some definitions. We'll also talk about what kinds of tests, if you're concerned about your blood sugar or have people that you work with and you're concerned about their blood sugar, the kinds of tests that you want to do. And also we'll get into, obviously, some supplement options for blood sugar management. So a little bit about me. I am, as Jonathan mentioned, AOR's newest medical advisor. I've been with the team for about 6 months now, really enjoying myself. And one of the reasons that AOR sort of piqued my interest and this role piqued my interest was that I've been using their products in my dispensary for the last 8 years and have been getting really great clinical results with them. So I feel very strong about the sort of the research and the formulations of the products, and first and foremost, they've given me good clinical results with my patients over the years, which is very important. So I am a naturopathic doctor. I have a private practice in North Vancouver, and I've been in private practice for a little over 8 years now, enjoying myself very much in that role. In addition, I have some certifications, first one being as a DAN doctor, a DAN practitioner. DAN stands for Defeat Autism Now, and it is a certification to help work with children on the autistic spectrum, a biomedical approach started in the United States and have done some training down there for that. In addition, some training as an IMMH practitioner, so integrative medicine for mental health, really interesting research and clinical practice around helping mental health conditions through integration of conventional pharmaceuticals, but also through supplements and key vitamins and minerals and such. So that's a little bit about me. So let's talk a bit about blood sugar and optimizing blood sugar. And I just want to preface before we talk here, you can see the slide here about statistics in Canada. I want to talk about a talk I saw from Dr. William Davis, a medical doctor, a couple of months ago now, and he's the author of a book called The Wheat Belly, which you may or may not be aware of. A very interesting read. If you haven't read the book, I encourage you to pick it up and have a read. It's all about sort of why we as a society are not very healthy. Chronic disease tends to be up across the board, and he's citing one of the main reasons for that is our reliance on wheat and wheat products in our diet, because wheat and wheat products basically create simple carbohydrates, and those simple carbohydrates convert to sugar in our body. And the stats that he was quoting in this talk that I saw a few months ago was saying that in the United States now, about 1 in 3 Americans are either pre-diabetic or diabetic. That's a shocking statistic, and it really shows that from a health perspective, what people are eating on a regular basis is really not serving them well if those challenges are happening at that amount. It's just really something that needs to get our attention. Certainly has reached epidemic proportions down there, and it's about to reach epidemic proportions up here. You can see from this slide. So the Canadian population is roughly about little over 33 million people. Of that population, it's estimated now that a little over 3 million Canadians are diabetic, and about 6 million are pre-diabetic. So that means that they're not on any medication or having to do insulin yet, but they are having challenges with elevated blood sugar. of those numbers, about 90% are type 2 diabetics. And we'll get into the distinctions between type 1 and type 2 diabetes shortly here. But just as sort of a little bit of a preview, type 2 diabetics are basically ones that control their blood sugar without insulin and may have to be on another pharmaceutical medication, but largely can be controlled through healthy eating and healthy lifestyle. Both type 1 and type 2 diabetes are on the rise. So we continue, despite our knowledge about what a healthy lifestyle looks like, both type 1 and type 2 diabetes are continuing to be on the rise, and our blood sugar as a general population is still getting more and more out of control, unfortunately. So looking at some costs around managing diabetes in Canada, yearly costs are anywhere between $1,000 and $15,000 per year per patient. And it's estimated by the year 2020, which is actually not that far away now, but 7 years, that it'll cost approximately $17 billion a year to the healthcare system to manage the challenges of diabetes. That's a pretty astounding number. It certainly got my attention. So this is a very significant part of our healthcare system and will continue to be in even larger amounts down the road here. So getting into some specifics around types of diabetes, and this is just a slide showing all the different types I'm going to discuss over the next little bit here. We've got type 1 diabetes, which is an autoimmune condition, classically a type 1.5 or latent autoimmune, and another word for that is LADA. Type 2 diabetes. Gestational diabetes is the diabetes that happens to women during pregnancy. Mature onset diabetes of youth, or MODY. Neonatal diabetes, so diabetes of infants in the womb and in early days, and then other issues for blood sugar challenges or diabetic complications, chronic pancreatitis, so inflammation of the pancreas, exposures to chemicals, traumas to the area of the pancreas, which obviously manages insulin and blood sugar, and or issues with surgery. So looking at type 1 diabetes, so if you're a type 1 diabetic or tipping in that direction, this is how you would present or how your patients would present. So they're generally on the lean side. They have challenges maintaining weight or they're losing weight. The 3 Ps here, polyuria, polydipsia, polyphagia, are all medical speak for peeing too much is polyuria. Drinking too much, i.e. water, being very thirsty, is polydipsia, and polyphagia is overeating or needing to eat a lot, not getting satiated or feeling full. Issues with fatigue are present often here. Mood swings, really kind of up and down in their moods, either quick to anger, depressive moods, kind of just really flip-flopping back and forth. And they tend to have challenges with infections, so these can be to different areas of the body. Some examples are recurrent bladder infections, infections around the genital area, and or skin infections. With respect to diagnosis and running laboratory workup on these patients, you'll find that their blood glucose levels or blood sugar levels are on the high side, very high side. Ketoacidosis is basically a marker of sort of the inflammatory processes from the fallout of high blood sugar. One of the things that the body does is produce ketones in the blood, and so ketoacidosis is a measurement of that. Again, these patients are lean and they want to drink a lot of water and they urinate a lot and they have problems with their weight. Typically, with respect to sort of who these patients are, they tend to be potentially children or teens or people in their early adult years. And with respect to other tests with the immune system, they have positive antibodies for the beta cells of the pancreas that produce insulin. So that makes it that autoimmune condition whereby the immune system thinks that these cells are foreign and attacks them. And the pancreas basically shuts down because those cells that produce insulin can't be created. They get attacked. So moving on to type 1.5 or the latent onset, or LADA as it's classically referred to. So this is diabetes that happens in adult years. It's a type 1 presentation, but obviously slower onset as it's happening in the older generation as opposed to the younger generation. I have here no insulin resistance, and that's not an absolute. There may or may not be insulin resistance is probably a better way of looking at that. So we'll get to the specifics of insulin resistance in just a minute. Unknown causes with respect to this, so it's not necessarily an autoimmune condition. It may be from a previous infection. It may be some potentially genetic concern that sort of went unnoticed. There's no sort of set pattern for how this presents, and it can be women and men, and age ranges from 35 to 60 typically. With respect to their presentation, or these patients' presentation, the LATA patients, they are also on the lean side. They tend to not have a history of diabetes in their family. They're not producing any ketoacidosis or ketones in their body. Their blood sugars are definitely elevated, although not necessarily as high as the type 1 patients. They have normal lipids or cholesterol levels, and their liver enzymes are usually normal as well. They have an elevated marker of A1C or hemoglobin A1C, and we'll get to the definition of that and what that is in just a moment. And as I said on the previous slide, they may or may not have insulin resistance. So with respect to insulin resistance, that basically means that the cells of our body fail to respond to insulin and are not able to take in the glucose. So basically, insulin is secreted as a signal for the blood, so for the cells to take up the glucose as fuel. That's insulin's role. And so insulin resistance is an issue with the cells failing to respond to that. So whether it's the receptors or some other chemistry in and around the cell that's not allowing for that reaction to take place. So so type 2 diabetes is issues with the insulin resistance, and as I said, this is the most common form of diabetes, the type 2 presentation. Potential causes here, so there can be some genetic concerns. Feast or famine genes basically are genes that sort of turn on when there isn't much to eat, or i.e. there's been a fast, and it really sort of packs any sort of thing taken in calorically basically gets packed on into fat storage because the body doesn't think they're going to get fed again. Certainly nutritional deficiencies can play a role, and we'll get into the specifics of some of that down in the talk in a little bit here. Gluttony basically is patients just overeating, not making smart food choices, having too many servings of food, too many calories over the course of the day, not burning those calories off, taking in too much and not expending enough energy-wise. Excess refined carbohydrates, so those simple carbohydrates that convert easily to glucose in the body, having too many of those in the diet. Lack of exercise, not exercising adequately enough. Inflammatory processes in the body can certainly cause challenges with insulin resistance and those cells not responding to insulin and taking in glucose properly. Abdominal obesity has certainly been shown to be a stepping stone to type 2 diabetic complications. Increased saturated fat is basically the poor fat in the diet as opposed to the good fats. Environmental toxins or exposure to toxins can cause challenges with cellular processing, including management of blood sugar. Dysbiosis is imbalance of beneficial versus non-beneficial bacteria in the digestive system and beyond, and that can certainly complicate things. And then lastly, infections or illness. So having the immune system busy with managing infections and fighting infections can, on a long-term basis, potentially challenge insulin and blood sugar management. So a little bit of another slide sort of looking at it in a slightly different way. We've got inherited influences. So looking at mutations potentially at a genetic or cellular level with respect to the insulin receptor, the glucose transporter, so taking the glucose into the cell, or signaling proteins that basically allow for those reactions to happen. And then acquired issues creating insulin resistance, as we've spoken about before: inactivity, not enough exercise, obesity, carrying too much weight, stress, certain medications, and then toxic levels or exposures, which cause challenges with both glucose and lipids in the body. So this slide, again, on the subject of insulin resistance, this slide I really want to draw your attention to this, and it's showing its relationship that blood sugar management, if it's poorly managed, is a real stepping stone to heart disease. And they are really a package deal these days, and have been shown to be almost the main driving force in patients developing cardiovascular challenges long-term, is that they've had long-standing issues with poorly managed blood sugar. And it may or may not even be classically a diabetic complication. It may be a pre-diabetic complication, or just poorly managed blood sugar across many years. So that creates insulin resistance. Those cells not able to respond adequately to insulin and take in glucose into the cell, and that causes obviously issues with hyperglycemia, which is high blood sugar. Dyslipidemia is basically challenges with cholesterol levels. Hypertension is high blood pressure. Damage to the vessel walls because it's managing inflammation. It causes challenges with clotting, so tendencies to potentially clot and be higher potentials for strokes long term. And then obviously just full-blown inflammatory processes in the body. And that all the management of that, how the cardiovascular system responds to that, or the long-term complications of that, is challenges with atherosclerosis, or hardening of the arteries. So less circulation, more compromises to the cardiovascular system long-term. So sort of a combination of blood sugar challenges and also challenges with cholesterol and challenges with blood pressure and being overweight, that sort of all as a package deal presents as something called metabolic syndrome. So that's basically a collection of all of these things, and here are some guidelines around that. So a fasting glucose or a fasting blood sugar of over 6.1 millimoles per liter, a blood pressure higher than 130/85, triglyceride level of over 1.7 millimoles per liter, and an increased abdominal weight size for men over 102 centimeters and for women over 88 centimeters in circumference. So with respect to insulin resistance or metabolic syndrome, again, just another slide to sort of paint a little bit of a different picture for you. You potentially get all of these things, all of these challenges, and these are big things to manage long term. If you look at the statistics on pharmaceutical medications, three of the big ones are managing blood sugar, obviously, blood pressure, and cholesterol challenges. So that's, it's a real package deal that insulin resistance and challenges with blood sugar management can be a stepping stone to all of these things. I want to draw your attention to on the slide, the sort of bottom left-hand one at about the 8 o'clock sort of thinking of a clock at about the 8 o'clock level there. PCOS stands for polycystic ovarian syndrome. So women with challenges with blood sugar management can over time develop challenges with polycystic ovarian syndrome. So that can be a real key to managing that condition, is making sure that blood sugar is in check. So presentation of a type 2 diabetic. Instead of being on the lean side, they're on the heavy side. They have abdominal obesity, so bigger bellies. They tend to have challenges with fungal infections or thrush, so that can be an oral thrush or thrush in the reproductive area. Fungal infections can be athlete's foot, can be issues with jock itch, can also be issues with fungal presentations on other areas of the body. Acanthosis nigrans is basically a skin condition causing a darkening of the skin, pigment changes in sort of patchy areas on the skin on different areas of the body, and that can be a sign that the diabetic patient, the type 2 diabetic patient, isn't managing their blood sugar well. Skin tags, sort of those little outcroppings of skin that almost look like little mushrooms, are signs that blood sugar is not being managed well and can be a presentation in a type 2 patient. Poor wound healing, again, they can, getting infections and have tendencies to keeping unwell for longer periods of time, and or getting recurrent infections, kind of one on top of the other. Also, even with respect to wounds, and certainly in lower body areas, sort of furthest away from the heart and cardiovascular system, especially in the area of the feet, tend to have challenges with healing those wounds. And then lastly, with respect to polydipsia, they can be on the thirsty side as well. So some basic labs, if you're concerned about your blood sugar, or you've got patients concerned about, and you're concerned about their blood sugar, these are some of the things you might want to think about running on them, just to get a flavor for what's going on with them with some specific chemistry. So you want to obviously get a fasting glucose level. This is a blood glucose level, having been away from food, to see what that level is. A postprandial glucose is basically after having something to eat and or having something specifically sweet in the laboratory, and then remeasuring that to see how the body responds to that increase in glucose in the body. Hemoglobin A1C is a marker which basically measures how much glucose is sticking to the red blood cells, and so this has been a marker that has been getting a lot of play as of late, and is becoming more and more recognized as a very reliable measurement for both inflammation in the body and also blood sugar management in the body, and being equally as relied upon or looked upon as the fasting blood glucose level as well. C-peptide or C-reactive peptide, even another word for that, CRP, an inflammatory marker, sort of tying blood sugar levels and cardiovascular inflammation. Standard blood labs with respect to complete blood chemistry, electrolytes, and lipid profiles, looking at cholesterol levels as well. Ferritin is a measurement of iron in the body and how the body's responding to iron levels. Liver enzymes will be elevated if there are challenges with inflammation and blood sugar complications long term, so you want to take a look at what the liver's up to. Vitamin D3 levels. Low vitamin D3 in the body can be a challenge and can be a real issue potentially with managing blood sugars if that level is not in check. So that's definitely something you want to look at, and I'll elucidate that a little bit more in subsequent slides here. Diabetic antibodies, we mentioned the autoimmune connection, certainly with respect to the type 1 presentations, so we want to look and see if there's any autoimmune conditions looking at antibodies. And then if there is diabetic type 1 presentation, the other things you want to look at because of that autoimmune condition are a thyroid panel to look if there's any antibodies with respect to the thyroid and the thyroid hormones, and also antibodies for celiac or gluten from wheat. That can also be often along for the ride with respect to type 1 diabetes. With respect to physical exam, because of that connection between poorly managed blood sugar and cardiovascular health, you want to do a thorough heart and lung exam, including a blood pressure, obviously, and often a cardio stress test through the GP or through the cardiology department at the hospital to get some increased information as far as what's going on with the cardiovascular system. Neuropathy is one of the complications of poorly managed blood sugar, and that's basically an issue with circulation and an issue with nerve function and nerve pain, and we'll get to some specifics on that in just a moment. But it's checking for numbness and loss of sensation and or pain in the extremities, and oftentimes this presents in the feet. We talked about skin presentations with respect to pigment changes and acanthosis nigrans, and also outcroppings of skin with the skin tags. So having a good look at the patient's skin, head to toe, seeing if there's any challenges, also looking for any fungal infections. Again, this might be clues. An eye exam. Probably all keenly aware that diabetic challenges and or poorly managed blood sugar can lead to challenges with the inner workings of the eye. So either yourselves as NDs or other medical professionals and or turning these patients over to an optometrist or an ophthalmologist to get real good data information on what's going on with the health of the eye. A thyroid exam, basically just a palpation of the thyroid area, feeling for any nodules, feeling for any bogginess, tenderness, any patient discomfort with respect to the palpation in around that area, helps to give clues as to what's up with the thyroid. And then obviously checking for how the patient's weight is distributed, BMI, body mass index, looking at their weight obviously and their waist circumference. So with respect to diabetic goals, and these certainly vary, but with respect to sort of this from the Canadian Diabetes Association, the standard goals are here for you to look at. So hemoglobin A1C level, we want that 7 or less. A lot of doctors are even suggesting that that should be a lot lower, even sort of in the level of 6 or 5.5, just anecdotally. But the Canadian diabetic goal is 7 or less. A fasting glucose of between 4 to 7 millimoles per liter. A postprandial glucose or after eating glucose measurement of between 5 and 10. An LDL or low density lipoprotein, this is what's classically known as the bad cholesterol, between 2.5 and 3.5 millimoles per liter. A total cholesterol HDL ratio of less than 4.5, and a blood pressure of 130 over 80 millimeters of mercury. With respect to lifestyle goals, pretty basic things to think about here. Easy to talk about and a lot harder for folks to put into practice. So routine exercise, absolutely key for managing blood sugar. And especially if you are pre-diabetic or diabetic, it is not an option. Routine exercise, in my opinion, is absolutely mandatory if you want to facilitate not having to increase the medication you're on and staving off subsequent complications of poorly managed blood sugar that we've already talked about. For those people that are type 2 diabetic and are on the overweight side, weight loss needs to be accomplished, and that's through healthy eating and exercising. If these patients are smokers, that is just a real bear in the system, like pouring gasoline on a fire. So stopping smoking is really necessary for managing blood sugar and diabetic complications long term. And then stress management. Again, stress being the stepping stone to pretty much any challenge with respect to disease process in the body. Managing stress is key to managing blood sugar. So the benefits of exercise, just to look at this. And again, with respect to exercise, the definition of exercise really is that you need to break a sweat and you need to sort of elevate your cardiovascular rate and rhythm. And so I'm not saying that you need to be a triathlete, but you need to get out there, and your patients need to get out there sort of a minimum of 3 times a week, and they need to elevate their heart rate and they need to break a sweat. And whether that's done through workouts at the gym, cardiovascular and resistance training, and or workouts outside, walks and runs that meet those goals, it's really up to every individual to find something that works. With respect to exercise, too, I find that the compliance is often a lot higher if people have a buddy, if they have a partner, if they have somebody that they can do the exercise with. Because when we're just accountable to ourselves, we always find excuses on why we don't get out for exercise. We need to do the laundry. We need to, look at our books, financials. We forgot to eat something. We didn't get enough sleep last night. You name it, the list goes on. But if we have a partner that we can exercise with or a group that we're accountable to, we tend to be a lot more compliant. So exercise needs to happen, and it always is better if you've got somebody to exercise with. So looking at some benefits here. So decreasing that insulin resistance, getting those cells to respond to insulin again. Decreasing lipids, getting the bad cholesterol levels down. Reversing a fatty liver, the liver being one of the major organs of inflammation management, and we talked about liver enzyme measurement. Fatty liver complications are basically when glucose is poorly managed long-term and the liver starts to sort of long-term inflammatory processes cause a fatty liver to come about. Exercise lowers blood pressure. It obviously promotes weight loss, increases lean muscle mass, improves sleep, where a lot of our internal inflammatory management and sort of management on other chemical levels, including blood sugar, happens with a decent night's sleep. And then obviously an elevated mood, and with that, stress management because of the natural endorphin production that happens during exercise. The benefits of weight loss, or getting back to a optimal weight, especially obviously for the type 2 diabetic or pre-diabetic patients who are obese. So with weight loss, we get better glucose control. We get a lowered blood pressure. We get a lowered cholesterol, and when I say that, I mean lowered of the bad cholesterol. Less inflammation in the body. So it's been shown that the more additional weight we carry, the more prone we are to inflammatory conditions. So optimal weight lowers inflammatory processes. Less diabetic complications, and we'll get into the specifics of those in just a minute. Less need for medications, both medications to manage other inflammatory processes or medications to manage diabetes and blood sugar complications. And with respect to goals, you want to be shooting for about 1 to 3 pounds per week until your target weight is reached. So you don't want to lose weight too quickly, and you don't want to take too much time to lose the weight either. With respect to stress and diabetes and how that relates, especially in the type 2 diabetic patient, stress will raise blood glucose levels because the increasing stress hormones decrease the insulin resistance. So the higher the stress hormones, those being adrenaline and cortisol, there's a decreased insulin resistance, and our cells don't respond, again, properly to insulin and don't take up glucose into the cells as well as they should. And obviously stress hormones interfere with sleep and getting to sleep at night or maintaining a good night's sleep through the course of the night, and that can also monkey with the internal chemistry that helps to manage blood sugar as we rest. So here is a list, and certainly not a complete list, but sort of a list of some key things that happen to the body with diabetic complications and poorly managed blood sugar long term. So we talked about diabetes and blood sugar challenges being a stepping stone to cardiovascular disease. Part and parcel with that is blood pressure. We talked about the issues with diabetic complications and blood sugar challenges with the health of the eyes. A long-term complication, obviously, or a chronic complication can be losing your vision or blindness. Kidney disease, because of those inflammatory processes in the body having to manage that, the kidneys and the filters in the kidneys become damaged long-term, causing some disease processes to go on at the level of the kidney. Nerve damage, we talked about neuropathy and challenges with numbness and tingling and pain, especially in the extremity areas. Amputations, there are people that actually, because their diabetic conditions are not managed well, their blood sugars are out of control, they lose their circulation and their nerve function, especially in their lower limbs, and they often will have to have their foot or their lower leg sort of at below the knee amputated. Liver disease, again with the liver being the major organ of inflammatory management in the body, long-term inflammatory complications or inflammatory chemistry can compromise the liver and create liver disease. And then I'm sure everyone's keenly aware of gestational diabetes, and when that is not managed well, there can be pregnancy complications. So it's always important for women who are pregnant, who have challenges with their blood sugar, to manage that very well for a healthy pregnancy and delivery of the child. So this is just a schematic looking at all of the things we just talked about, and if we just sort of go around here like a clock, we start up sort of at the 12 o'clock area there, looking at the brain. So issues with poorly managed blood sugar complications increase risk of hemorrhage and stroke. With respect to the eye, cataracts and glaucoma. With respect to heart, myocardial infarcts, basically challenges with those specific areas of the heart muscle. The islet cell loss, so the islet cells are the cells in the pancreas which produce insulin, so there's challenges there. If we go down to the side there, we can see a picture of the foot and a darkened foot, which basically means that there's poor vascular perfusion of that foot. They're having challenges with circulation and nerves, causing gangrene to set in, which would be a stepping stone to an amputation there. Autonomic neuropathy in the bladder area, so challenges with pain and or incontinence. Peripheral neuropathy at the level of the hands, so pain in the hands, increased challenges potentially in the carpal tunnel or beyond. Kidney challenges. We talked about hardening of the arteries, atherosclerosis in all of the vascular areas in the cardiovascular system, and high blood pressure, hypertension, which obviously compromises all of the vascular system, and it's showing it there in the main branches going up into the head. Carotid areas definitely be a challenge to all areas of the cardiovascular system. So, some dietary considerations, and again, really easy to talk about and often very difficult for people to put into practice. You've got, if you want to manage your blood sugar well, you've got to get the simple carbohydrates significantly down or out of your diet. It's just not something that you can maintain in your diet and have a healthy blood sugar long term. So Dr. Bernstein is a medical doctor who's done a lot of work with low carbohydrate diets and specifically low simple carbohydrate diets and or calorie restricted diets, and had very, very good success with getting patients' blood sugar managed very quickly and very well long term if they comply with those kinds of diets and programs. So in addition to that, there has been some research, and many patients have found that they do better and their blood sugar gets managed in a better way when they go gluten-free or dairy-free. And that may be related to allergenic connections to those food items, so gluten being the protein in wheat. Dairy-free, again, often very allergenic for people, and those allergies create inflammatory conditions both in the digestive system and beyond, and it can those inflammatory chemicals can interfere with management of blood sugar. And certainly we talked about the connection between type 1 diabetes and autoimmune and the potential connection for gluten challenges from an autoimmune perspective and or celiac, so there's that connection there. So with respect to other dietary considerations, we want to facilitate or educate patients on having lean, clean protein sources. So basically, really the least amount of chemicals and processing of the proteins as can be it fish. Wild fish as opposed to farm fish, generally speaking, with respect to poultry, hormone-free, pesticide-free, chemical-free, as well as our lean meats, beef, turkey as well, making sure that those are as clean as possible. And really adhering to something called the rainbow diet. And the rainbow diet basically means ensuring that your diet is as colorful as possible. All of those different colorful fruits and vegetables all have beneficial chemicals that help to manage health, including blood sugar. So making sure that when you're sitting down to eat that you have at least 3 to 4 colors on your plate. That ensures that you're getting some good beneficial nutrients in your diet. I'm going to talk about some supplements now, and with respect to this is basically just a slide showing all of the ones we're going to talk about, and just to give you a little preview of coming attractions here, and we'll jump right in. So first one I want to talk about, and one that I've certainly used in my practice with patients in managing their blood sugar, is alpha-lipoic acid, and specifically the AOR R plus SR product. The R form of alpha-lipoic, so there's the chemistry of alpha-lipoic acid, oftentimes sort of the less chemically less bioavailable and less efficacious form of alpha-lipoic acid is the L form, and L versus R is basically a chemical designation, and the R form has been shown to be much more A, bioavailable, and B, therapeutic for managing blood sugar. Alpha-lipoic acid is an antioxidant, so it helps to scavenge free radicals or the inflammatory fallout of managing inflammation and blood sugar complications. Alpha-lipoic acid has been shown to improve the cellular uptake of glucose, so it helps to get that glucose into the cells. It's been shown to prevent diabetic complications. So if you remember that chart of the body a couple of slides ago, it helps to prevent all of those complications. And the SR form basically is the sustained release form. So it slows the release of the alpha-lipoic acid in the body, and the SR forms have been shown by 46% to reduce blood glucose. So very effective at lowering that level. And again, with the complications, particularly helpful in those patients that have challenges with diabetic neuropathy, that sort of numbness, tingling, and potentially pain in the lower extremities, especially the foot. Fiber, definitely something to consider, and again, because many of us and our patients with blood sugar challenges aren't getting enough servings of fiber through fresh fruits and vegetables and other sources, there needs to be some additional fiber brought on board. So the AOR Solio Fiber product is a great option. Fiber has been shown to reduce the glycemic index of food, so basically that sort of sweetness or apt for that food to convert to glucose. It helps to enhance insulin sensitivity, so it gets those cells to respond to insulin again to get that glucose into the cell. It can delay the absorption of carbohydrates, and specifically the simple carbohydrates, so it helps to balance the blood sugar after a meal. It prevents that sort of spike from happening too quickly. It's been shown to have a role in blood sugar regulation, so it helps to, blood pressure regulation, so it helps to manage blood sugar, blood pressure. And it's been shown to lower cholesterol, and specifically the LDL, or the low-density lipoprotein, classically referred to as the bad cholesterol. Antioxidants, definitely something to think about, and alpha-lipoic acid we just spoke of as an antioxidant, but other antioxidants to consider, vitamin C. And particularly this AOR product with the vitamin C in combination with other bioflavonoids, free radical scavengers, so again helping to get those inflammatory chemicals, the byproducts of poorly managed blood sugar, up and out of the system, naturally anti-inflammatory, as well as being antithrombotic, so helping to prevent, helping to manage potentials for lowering stroke, an instance of stroke, or other clot challenges. And as we all know, vitamin C is great at helping with the immune system and as an immune booster, so helping with infections and preventing infections, and also helping with wound healing and making the wound healing processes work better. Another antioxidant for consideration is green tea, and specifically the active green tea product here. The active ingredient in green tea is EGCG, and it's been shown in doses of 200 milligrams or more to reduce serum glucose, so it helps to lower just the general blood sugar level. It helps to reduce hepatic glucose production, so that's production of glucose at the level of the liver. It helps to reduce oxidative damage, so again, that's the sort of inflammatory fallout from poorly managed blood sugar, and is also a liver protector. Vitamin D, again, we talked about with a laboratory workup, potentially looking at a serum vitamin D3 level to see if that's in optimum range. And many of us actually have poor or low levels of vitamin D in Canada, and especially us out here on the West Coast with our gray, rainy climate. We tend to not get a lot of vitamin D exposure through sunshine. So it's definitely something to consider, and especially something to consider in your patients with blood sugar challenges. So dosing between 1,000 and 4,000 IUs a day, looking with that, anecdotally speaking, often doctors will even go higher than that, depending on if there's other inflammatory processes or immune system compromises in conjunction with the blood sugar, so up to potentially 10,000 IUs, just as an awareness there. It's been shown to reduce insulin resistance and enhance insulin release. So it basically makes the blood cells take up the sugar better, lowering the insulin resistance, and helps insulin release in the body. Some herbals to look at, first one being Gymnema and the Gymnema 75 product from AOR here. Gymnema is an Ayurvedic herbal, and so it's been around for centuries, and it is a diabetic remedy in the Ayurvedic medical community. First clinically tested in the 1930s and shown to reduce blood glucose levels and in insulin and non-insulin dependent animal models. It's also been shown to regenerate beta cells, so those cells in the pancreas that produce insulin, both enhancing insulin secretion and sensitivity. So a real win-win in both of those areas. Definitely something to consider with respect to healthy blood sugar and healthy insulin production and utilization. Another one to think about in a large line in the AOR family are the curcumin products. Curcumin is a herbal, but it's really a spice, and it's been shown to reduce levels of glucose, so the blood sugar level, lowering levels of hemoglobin A1C, helping with insulin resistance, acting as an anti-inflammatory, and then also helping with staving off or managing Alzheimer's in diabetic patients. Moving to some minerals now. First one for consideration is magnesium. And magnesium, and with the Mag-K taurine here, we'll get into why K stands for potassium and taurine we'll get to in a moment. So looking at the Mag-K taurine product here or any of the other magnesium products in the AOR line, it's been shown that magnesium deficiency is common in diabetes due to urinary magnesium loss. So patients with diabetes and poorly managed blood sugar excrete magnesium in higher levels than normals. And with low intracellular magnesium, there's impaired insulin action and worse resistance. So magnesium is really important in making insulin work well and getting the cells to respond well to it. Potassium and the vitamin K2 product from AOR here. Potassium has been shown to improve insulin sensitivity and secretion. Patients who are on insulin and have to inject to maintain levels of insulin in their bodies those injection and that injection process can cause a loss of potassium. And obviously, potassium is also needed for the intracellular sodium-potassium pump. Another mineral, and certainly one that I've used in practice with good success, chromium, and the chromium picolinate product here from AOR. Chromium has a role in glucose management, is the sort of center molecule for something called glucose tolerance factor in the blood, and it's been shown to help with a cellular role of managing insulin, and studies showed marked improvement, especially in blood sugar levels with type 2 diabetes. Other suggestions, moving on here, looking at NAC, N-acetylcysteine. N-acetylcysteine is an amino acid, and it's a precursor to glutathione, which is one of the major antioxidants in our body. It's been shown to reverse insulin resistance. It's been shown to stop oxidative damage caused by high blood sugar levels. It's been shown to protect both the liver and the kidneys from this oxidative damage. It's been shown to help reverse diabetic neuropathy, and it's been shown to help lower blood pressure. So a real win-win across the board with N-acetylcysteine and a lot of the challenges in poorly managed blood sugar. Another suggestion is the amino acid taurine. Taurine, specifically with respect to red blood cells, it's been shown to prevent the oxidative damage caused by high glucose levels. It helps to prevent lipid peroxidation, so sort of the toxic lipids from being produced. It's been shown to prevent glycated protein formation, and basically glycated proteins are the ones that are very damaging and cause a lot of inflammation in the body, so it helps to facilitate lowering that potential. It works synergistically with N-acetylcysteine. It's a good partner in combination. And taurine has been shown to be high in levels in the eyes and the heart and the liver. And we talked about the challenges that diabetic and patients with poorly managed blood sugar have in those areas of their body. So to get taurine back into those areas helps to maintain the health of those areas. And also it does protect the kidneys and from damage of high blood sugar. Another suggestion is the Benagine product. Benagine being a Krebs cycle intermediate, the Krebs cycle being sort of the main energy production cycle in the body. And this has been confirmed to reduce glucose levels and improve the uptake of glucose without any negative side effects in human trials. So a really interesting product and potentially one to consider here for managing glucose. It's an effective hypoglycemic agent too, so to prevent patients from crashing with very low blood sugar levels, it's effective at helping to facilitate the blood glucose not going too low. And then lastly here, the Orthoglucose 2 product, which is basically a one-stop shop for blood glucose management. It's got a lot of the ingredients that we already spoke about previously, in addition to a couple of other ones, which I want to bring your attention to. So the first one being cinnamon. Cinnamon is, again, another spice, but really great at helping with blood sugar, both dietarily, using it in foods and in your cooking, but also here in this formula, cinnamon has an insulin-like activity and improves glucose uptake. It will reduce and has been shown to reduce levels of hemoglobin A1C and to reduce lipids, especially the poor or the bad cholesterol, the LDL. And Mamortica or bitter melon, it has a hypoglycemic effect, and it's been shown to reduce blood sugar levels by as much as 54% in one trial. So again, really potentially great option here, helping to control blood sugar levels and getting those levels down. So that concludes what I've got here for you all with respect to optimizing blood glucose levels. I hope that it's given you some good information and some good takeaways. Again, I just wanted to really hit home the fact that this is an epidemic in North American culture, and poorly managed blood sugar is a real complication and a real stepping stone to lots of other challenges and inflammatory processes in the body, and it really needs to be managed well, long-term, for patients to have a long and healthy life. I'd like to thank you for joining me today, and I look forward to speaking with you in the future. Thanks very much.